Your blood pressure numbers are telling you something important about your health right now. Most seniors look at their reading, wonder if it is okay, and move on. They miss what those numbers actually reveal about their heart, their arteries, and even their daily habits. I'm Dr. Ben Harris, and today I want to walk you through what your blood pressure is really saying about your body. The order we go through these matters because each reading pattern builds a bigger picture, and I will save the most overlooked connection for the end. Before I begin, I want to ask you something simple. Comment your age and your usual top number range. Just tell me if you are usually in the 120s, 130s, 140s, or 150 or above. I read every comment, and it helps me understand who is watching. Now let me share what your blood pressure is actually revealing. 1. What your top number reveals about your arteries. Harold was 72 years old when he came to see me about his blood pressure. He had been checking it at home for about a year. Every time he looked at the monitor, he asked himself the same question. Is this okay or not okay? His top number was usually around 148, sometimes 152, sometimes 145. He figured as long as it stayed in that range, he was fine. He never thought about what that number actually meant. He just wanted it to stay the same. When I asked Harold what he thought his top number was telling him, he shrugged. He said he assumed it was just something that goes up with age. He thought everyone his age had numbers like that. What Harold did not realize was that his top number was revealing something specific about his arteries. The top number is called the systolic pressure. It measures the force inside your arteries when your heart beats and pushes blood out. This is the moment of maximum pressure. When that number is consistently elevated, it often means the walls of your arteries have become stiffer over time. In younger people, arteries are flexible. They stretch a little when blood pushes through, which absorbs some of that force. As we age, arteries can lose that flexibility. They become more rigid. When that happens, the heart has to push harder to move the same amount of blood. That extra effort shows up as a higher top number. Harold was not just seeing a number. He was seeing evidence that his arteries were not as flexible as they used to be and that his heart was working harder because of it. This matters because a heart that works harder over many years can start to thicken and tire. It also means the blood is hitting the artery walls with more force, which can cause wear over time. When I explained this to Harold, something clicked. He stopped thinking about his blood pressure as a single good or bad verdict. He started thinking about it as a window into how his arteries and heart were behaving. The first step is simply to notice patterns in your top number. If it is consistently in the 140s, 150s, or higher, that is useful information. Write it down. Bring it to your next appointment. Ask your doctor what it might suggest about your artery health. If your top number ever goes above 180, or if you experience symptoms like chest pain, severe headache, shortness of breath, or vision changes, that is a reason to seek immediate care. But for most seniors, consistently elevated systolic readings are something to track and discuss, not panic over. Understanding what the top number means is the first step to seeing your blood pressure as more than just a pair of digits. Here is another thing your readings reveal. 2. What your bottom number tells you about heart rest. Doris was 68 years old and had been managing her blood pressure for several years. She knew her top number well. It hovered around 138 most of the time. But one day, her doctor looked at her chart and seemed concerned about the bottom number. It had been dropping over the past year. It used to be around 78. Now it was closer to 62. Doris did not understand why that was a problem. She thought a lower number was always better. She assumed her heart was doing less work, and that was a good thing. When her doctor explained what the bottom number actually meant, Doris realized she had been looking at it the wrong way. The bottom number is called the diastolic pressure. It measures the pressure inside your arteries between heartbeats when your heart is resting and refilling with blood. This is the moment of lowest pressure in the cycle. A healthy bottom number means the heart has enough time and space to rest between beats and that blood can flow back into the heart muscle properly. The heart itself gets its own blood supply during this resting phase. When the bottom number drops too low, especially below 60, it can sometimes mean the heart is not getting as much blood flow during that rest phase. It can also suggest that the arteries have become so stiff that the pressure drops quickly between beats. In older adults, it is common to see a widening gap between the top and bottom numbers. The top number stays elevated or rises while the bottom number falls. This pattern is sometimes called isolated systolic hypertension. It reflects what is happening to the arteries over time. Doris had a top number of 138 and a bottom number of 62. That gap of 76 points was something worth noting. It told her doctor that her arteries were likely stiffer than they used to be and that her heart might not be getting optimal rest. If you check your own blood pressure at home, look at both numbers. Pay attention to the bottom number, not just the top. If your bottom number is consistently below 60, or if the gap between your two numbers is very wide, write that down. Bring it up with your doctor. This is not something to fear. It is something to be aware of. Many seniors live well with these patterns, especially when they take steps to support their heart and blood vessels in other ways. The bottom number tells you how well your heart is resting. That matters just as much as how hard it is working. If this information is helpful so far, consider subscribing to this channel. I share simple health guidance for adults over 60, focusing only on blood pressure and blood sugar. No complicated science. Just calm, useful information you can act on. Now let me share something that affects the accuracy of everything you have just learned. 3. How accurate home readings show the true picture. Eugene was 75 years old and had been checking his blood pressure at home for about 3 years. He was proud of how consistent he was. Every single day he sat down, wrapped the cuff around his arm, and pressed the button. But his numbers were all over the place. One day it was 158/88. The next day it was 136/76. Sometimes it spiked to 172. Eugene was confused. He thought something was seriously wrong with his heart. He worried that his blood pressure was unstable and dangerous. But when I asked him to walk me through exactly how he was taking his readings, the real picture became clear. Eugene was checking his blood pressure right after climbing the stairs. He was sitting on the edge of his bed with his legs dangling. His arm was resting on his thigh, below heart level. He was using a cuff that came with the monitor, but he had never checked whether it was the right size for his arm, and he often talked to his wife while the reading was happening. Every single one of those things was affecting his numbers. His readings were not showing what his blood pressure actually was. They were showing the effect of movement, posture, arm position, and even conversation. When Eugene made a few simple changes, his readings became much more consistent. Within a week, he realized his blood pressure was actually more stable than he thought. He had been scaring himself with inaccurate measurements. Here is how to get a true reading at home. First, sit quietly for at least 5 minutes before you check. Do not check right after walking, climbing stairs, eating, or drinking caffeine. Let your body settle. Second, sit in a chair with a back support. Do not sit on the edge of a bed or a stool. Keep both feet flat on the floor. Do not cross your legs. Third, place your arm on a flat surface like a table so that the middle of your upper arm is level with your heart. If your arm is too low, the reading will be higher. If it is too high, the reading will be lower. Fourth, make sure the cuff fits properly. The cuff should cover about 80% of your upper arm. If you have a larger arm and the cuff is too small, your readings will be falsely elevated. Most monitors come with standard cuffs, but larger cuffs are available and make a real difference. Fifth, do not talk during the reading. Do not watch television. Do not look at your phone. Just sit still and breathe normally. Sixth, take 2 or 3 readings, about 1 minute apart. Write them all down. Your first reading is often the highest. The second and third are usually closer to your true level. Seventh, check at the same time each day when possible. Morning readings, taken before medication and before eating, often give the most useful information. But consistency matters more than the exact time. If you are on blood pressure medication, accurate home readings help you and your doctor understand whether the medication is working. If your readings are inaccurate because of technique, you might get the wrong dose or the wrong advice. Eugene thought he had a problem. What he really had was a measurement problem. Once he fixed that, he could finally trust what his monitor was telling him. If you have not checked your cuff size or your posture lately, take a moment to do that before your next reading. It can change everything. This is something every senior can do at home without any special equipment or help. It just takes a few small adjustments. Now here is another pattern many seniors overlook. 4. What the difference between morning and evening readings means. Ruth was 71 years old and had been checking her blood pressure every evening before bed. She liked that routine. It was calm. She had finished her day. She would sit in her favorite chair, wrap the cuff around her arm, and check her numbers. Her readings were usually around 128/74. She felt good about that. But when her doctor asked about her morning readings, Ruth admitted she had never checked in the morning. She assumed blood pressure was the same all day. She did not see a reason to check twice. Her doctor suggested she try checking first thing in the morning, before eating or taking any medication. Ruth agreed to try it for 1 week. What she found surprised her. Her morning readings were significantly higher. She was seeing numbers like 146/82, sometimes even 150/86. By evening, her numbers had dropped back down to the 120s. Ruth had been missing an important piece of information. Her evening readings were reassuring, but they were not showing the full picture. Blood pressure naturally fluctuates throughout the day. For most people, it is lowest during sleep and rises in the early morning. This morning rise is sometimes called the morning surge. It is the body's way of preparing for activity after waking. In some people, this morning surge is more pronounced. Their blood pressure climbs higher than expected and stays elevated for the first few hours of the day. This pattern matters because research suggests that elevated morning blood pressure is linked to a higher risk of heart strain over time. Ruth was not doing anything wrong in the evening, but by only checking at night, she was only seeing her calmest numbers. She was missing the spike that happened every single morning. Once Ruth started checking in the morning, she had a better understanding of what her body was doing. She brought those numbers to her doctor, and they talked about whether her morning pattern needed attention. If you check your blood pressure at home, I encourage you to check at different times on different days. Try a few morning readings before eating or taking medication. Then try a few evening readings, compare them, look for patterns, some questions to ask yourself. Are your morning numbers consistently higher than your evening numbers? Is the difference small, like 5 or 10 points? Or is it large, like 20 or more points? Are your morning numbers in a range that concerns you? Write these patterns down. Bring them to your next doctor visit. This kind of information is often more useful than a single reading taken in a clinic. Ruth thought her blood pressure was under control. It was, but only in the evening. Knowing her morning pattern gave her a fuller picture. You do not need a fancy device to do this. The same home monitor works fine. You just need to check at different times and track what you find. Here is a quick reminder. If you are learning something useful in this video, subscribe so you do not miss the next one. I focus only on blood pressure and blood sugar for adults over 60. Everything is simple, calm, and straightforward. Now I want to shift to something that affects your blood pressure every single day, even if you do not realize it. This is where daily habits start to connect with your readings. What you do today can show up on your monitor tomorrow, and the patterns we will look at next explain why some readings seem to come out of nowhere. One of the biggest surprises for many seniors is how much their sleep, their stress, and even their afternoon routine can move their numbers up or down. In the next section, I will walk you through what sudden spikes might be telling you, what your sodium choices reveal, how movement habits shape your readings, and one connection between blood pressure and blood sugar that most people never think about. Each of these builds on what you have already learned. And together, they show you how your blood pressure is not just a number. It is a reflection of your daily life. Before we move forward, let me add something important about the patterns we just discussed. Many seniors focus only on whether their blood pressure is high or normal. But as you can see, there is much more information inside those two numbers. The top number tells you about your arteries. The bottom number tells you about your heart's rest. The difference between the two tells you about stiffness and flexibility. The difference between morning and evening tells you about your body's rhythms. When you start paying attention to all of these, you stop seeing blood pressure as a single verdict. You start seeing it as a conversation with your body. Harold, who I mentioned earlier, made a small shift after he understood what his top number meant. He stopped dreading his readings. He started treating them as information. He would sit down in the morning, check his numbers, and write them in a small notebook. After a few weeks, he could see patterns. He noticed that after a poor night of sleep, his morning number was higher. He noticed that on days when he walked in the afternoon, his evening number was a bit lower. None of this was complicated. It did not require special equipment or medical training. It just required paying attention. Doris, after learning about her bottom number, started asking better questions at her appointments. Instead of just asking whether her blood pressure was okay, she asked what the gap between her two numbers meant. She asked whether her bottom number was too low. She asked what she could do to support her heart's resting phase. These questions led to better conversations and better care. Eugene, once he fixed his measurement technique, finally had numbers he could trust. He stopped second-guessing himself. He stopped worrying that something was wrong with his heart. He had accurate information, and that gave him peace of mind. Ruth, after discovering her morning pattern, realized that the one reading she took each evening was not telling the whole story. She adjusted her routine. Now she checks once in the morning and once in the evening, a few times each week. She knows what her body does at different times of day. And that knowledge has made her feel more in control. Each of these seniors was not doing anything medically complex. They were simply learning to read the information their body was already giving them. This is the heart of what I want you to take from today. Your blood pressure is not just a test you pass or fail. It is a signal. It tells you what is happening inside your arteries, your heart, and your daily routine. The more you understand what those numbers mean, the more you can do about them. And here is something that ties this all together. The readings you take at home are often more useful than the readings you get at a clinic. This might sound surprising, but it is true for many seniors. When you visit a doctor's office, several things can raise your blood pressure temporarily: the stress of the appointment, the rushed feeling of waiting, the unfamiliar environment, the act of walking from the parking lot, the nervousness of seeing a medical professional. All of these can push your numbers up. This is sometimes called white coat hypertension. It means your blood pressure appears higher in the clinic than it actually is at home. On the other hand, some people experience the opposite. They feel calm and relaxed at the doctor's office, but their home environment is stressful. Their home readings are higher than their clinic readings. This is sometimes called masked hypertension. Both of these patterns can lead to misunderstanding. If your doctor only sees your clinic readings, they might not know what your blood pressure looks like during your regular day. That is why home readings matter so much. When you check at home, in your own environment, using correct technique, you are gathering information that your doctor cannot get any other way. Many doctors now ask their patients to bring a log of home readings to their appointments. If your doctor has not asked for this, consider offering it. A week or two of morning and evening readings, taken properly, can tell a much fuller story than a single reading in the clinic. You are not replacing your doctor's judgment. You are adding to it. You are giving them better information, and better information leads to better decisions. Now let me share something practical. If you do not already have a simple blood pressure log, you can create one easily. Take a piece of paper or a small notebook. Write the date in one column. Write the time in the next column. Write your top number, then your bottom number. You can also add a short note about how you were feeling or anything unusual that day. After a week or two, patterns will start to appear. You will see whether your mornings are consistently higher. You will see whether certain days are more elevated than others. You will see whether your numbers stay stable or jump around. This log becomes a useful tool, not just for you, but for anyone helping you manage your health. One thing I recommend is keeping the log somewhere visible. Put it next to your blood pressure monitor. That way, you remember to write your numbers down every time you check. Many seniors tell me they check their blood pressure but forget to write it down. Then, when they go to their appointment, they cannot remember what their numbers were. They remember a general sense, like I think it was okay, but they do not have the details. Details matter, patterns matter, and the only way to see patterns is to track them over time. This brings me to something else worth mentioning. When you track your blood pressure at home, you are not just collecting numbers. You are learning about your own body. You are noticing connections. You are becoming more aware of how your daily choices affect your health. This awareness, by itself, is valuable. It shifts you from being a passive observer to an active participant. You are no longer just waiting for a doctor to tell you something. You are paying attention every day, gathering your own information, and asking better questions. This is one of the most powerful things a senior can do for their health. It does not cost anything. It does not require special skills. It just requires consistency and curiosity. Now let me prepare you for what comes next. In the second half of this video, I will walk you through 4 more things your blood pressure reveals. These focus on daily habits and the connections between your readings and your lifestyle. You will learn what sudden spikes might be saying about your stress and sleep. You will learn what consistently elevated readings reveal about your sodium and fluid balance. You will learn what your blood pressure says about how much you move during the day, and you will learn about a connection between blood pressure and blood sugar that most seniors never think about. Each of these will include real examples from people I have worked with, and each one will give you something simple you can act on right away. By the end, you will have a complete picture of what your blood pressure is telling you and what you can do about it. Stay with me. There is more useful information ahead. 5. What sudden spikes can reveal about stress and sleep. Walter was 74 years old and had been tracking his blood pressure at home for several months. Most of his readings were reasonable. His morning numbers were usually around 142/80. His evening numbers were a bit lower. He had accepted that his blood pressure was slightly elevated, and he was working with his doctor on a plan. But every so often, Walter would get a reading that alarmed him. Out of nowhere, his monitor would show 168/94 or 172/96. These spikes seemed random. He could not predict when they would happen. He started to worry that something serious was going on inside his body. When I asked Walter to think carefully about the days when his spikes happened, he could not remember anything unusual at first, but I encouraged him to look more closely. I asked him to think about what had happened the night before each spike. I asked him to think about how he slept, what was on his mind, and how his body felt that morning. After a few weeks of paying closer attention, Walter noticed something. Almost every time he had a spike, he had slept poorly the night before. Either he had trouble falling asleep, or he woke up several times during the night, or he woke up feeling unrested. He also noticed that on the days before his spikes, he had often been dealing with something stressful. An argument with a family member, a worry about finances, a frustrating phone call. He had not connected these things to his blood pressure, but once he started tracking, the pattern became clear. Walter was not having random spikes. His body was responding to stress and poor sleep, and that response was showing up on his blood pressure monitor. This is something many seniors do not realize. Stress and sleep have a direct effect on blood pressure. When you are under stress, your body releases hormones that temporarily raise your heart rate and tighten your blood vessels. This pushes your blood pressure up. When you sleep poorly, your body does not get the recovery time it needs. Blood pressure that normally dips during sleep stays elevated, and the effects can carry over into the next day. For Walter, understanding this connection was powerful. He could not eliminate all stress from his life, but he could start managing it differently. Here is what helped him. First, he started paying attention to his sleep habits. He noticed that he often stayed up late watching the news, which left him feeling agitated. He made a simple change. He stopped watching the news after 8 in the evening. Instead, he listened to calm music or sat quietly before bed. His sleep improved within a week. Second, he started using a simple breathing exercise when he felt tense. He would sit comfortably, close his eyes, and take slow, deep breaths. He would breathe in slowly for about 4 seconds, hold for a moment, then breathe out slowly for about 6 seconds. He did this for just 5 minutes. It was not complicated, but it helped his body shift out of the stress response. Third, he started noticing his stress earlier. Instead of letting tension build up all day, he would pause and ask himself how he was feeling. If he noticed tightness in his shoulders or a clenched jaw, he would take a few slow breaths right then. This small habit helped him catch stress before it affected his readings. Walter still had occasional spikes, but they became less frequent, and when they did happen, he understood why. He stopped fearing them and started seeing them as signals that he needed more rest or more calm. If you notice sudden spikes in your blood pressure, do not panic. Ask yourself what happened the night before. Ask yourself if you have been under more stress than usual. Look for patterns. This is something you can address at home, today, without medication or special equipment. A few minutes of slow breathing, a calmer evening routine, a small change in what you watch or read before bed. These things matter more than most people realize. If you have any heart condition or breathing difficulty, speak with your doctor before starting any new breathing exercises. For most seniors, slow, gentle breathing is safe and calming. One simple habit like this can support steadier readings over time. Here is another factor that affects your blood pressure every single day. 6. What consistently high numbers say about sodium and fluid balance. Margaret was 69 years old and had been struggling with elevated blood pressure for years. Her readings were usually in the high 140s or low 150s, no matter what she tried. She felt frustrated. She thought she was eating reasonably well. She had cut back on adding salt to her food. She did not understand why her numbers stayed so high. When I asked Margaret to walk me through a typical day of eating, the picture became clearer. For breakfast, she often had toast with butter and a slice of cheese. For lunch, she liked soup from a can because it was easy to prepare. For dinner, she might have a frozen meal or leftovers from a restaurant. She snacked on crackers and sometimes deli meat. Margaret was not adding salt to her food at the table, but the food she was eating was already loaded with sodium before she even sat down. This is something many seniors do not realize. Most of the sodium in the average diet does not come from the salt shaker. It comes from processed foods, packaged foods, restaurant meals, canned goods, and prepared items. A single can of soup can contain more than half of the recommended daily sodium for an older adult. A frozen meal can contain even more. Bread, cheese, deli meat, sauces, and condiments all add up. Sodium affects blood pressure because it causes your body to hold on to more fluid. When there is more fluid in your blood vessels, the pressure inside those vessels goes up. For some people, this effect is more pronounced. Their blood pressure is more sensitive to sodium than others. Margaret did not need to eliminate salt from her life, but she did need to become aware of where her sodium was actually coming from. Here is what she changed. First, she started reading labels. She looked at the sodium content on packaged foods before buying them. She was shocked to see how much sodium was in some of her favorite items. She began choosing lower sodium versions when they were available. Second, she reduced her reliance on canned soups and frozen meals. She did not stop eating them entirely, but she cut back. On days when she had a high sodium lunch, she made sure her dinner was simpler. A piece of fish with vegetables, some rice with herbs instead of sauce. Third, she started cooking more simple meals at home. This did not mean complicated recipes. It meant basic foods prepared with minimal added salt. She used lemon, garlic, pepper, and herbs to add flavor instead of relying on sodium. Fourth, she increased her intake of potassium-rich foods. Potassium helps balance sodium in the body. Foods like bananas, oranges, potatoes, spinach, and beans are good sources. Margaret started adding a banana to her morning routine and having a small salad with dinner. Within a few weeks, Margaret noticed a change. Her readings started coming down, not dramatically, but consistently. She was seeing numbers in the low 140s instead of the high 150s. Over time, that trend continued. Margaret did not feel deprived. She still enjoyed her food. She just made more informed choices about where her sodium was coming from. If your blood pressure has been consistently elevated, take an honest look at your sodium intake. Not just the salt you add, but the sodium already in your food. Read labels. Track what you eat for a few days. You might be surprised at what you find. This is not about perfection. It is about awareness. Small reductions in sodium, sustained over time, can make a meaningful difference in your readings. If you have kidney disease or are on a potassium-restricted diet, speak with your doctor before increasing potassium-rich foods. For most seniors, adding more fruits and vegetables is safe and beneficial. Watching your sodium is a longer-term strategy. It will not change your numbers overnight, but over weeks and months, it supports healthier blood pressure levels. If you are finding this information helpful, take a moment to subscribe. I share calm, practical guidance for adults over 60, focusing only on blood pressure and blood sugar. No drama, no complicated science, just useful information you can act on. Now let me share something that affects your readings in a different way. 7. What your blood pressure reveals about your movement habits. Frank was 77 years old and had been fairly sedentary for the past several years. He had some arthritis in his knees, and walking for long distances was uncomfortable. He had slowly reduced how much he moved during the day. Most of his time was spent sitting in his living room, reading or watching television. Frank did not think this was affecting his blood pressure. He assumed blood pressure was about salt and stress, not about how much he walked. But his readings had been creeping up over the past 2 years. He used to be in the low 140s. Now he was regularly seeing 154, 158, sometimes 162. When I asked Frank about his daily activity, he admitted that he barely moved. He walked from his bedroom to the kitchen, from the kitchen to the living room, and back again. Some days, he did not leave the house at all. He felt tired and unmotivated. What Frank did not realize was that regular movement, even gentle movement, has a direct effect on blood pressure. When you move your body, your blood vessels become more flexible over time, your heart gets more efficient, your circulation improves. All of this supports healthier blood pressure. When you sit for long periods without moving, the opposite happens. Blood flow slows down. Blood vessels become stiffer. The heart has to work harder to push blood through a less responsive system. Frank did not need to run a marathon. He needed to add small amounts of movement back into his day. Here is what he started doing. First, he set a simple goal. Every hour he would stand up and walk around his living room for 2 minutes. Just 2 minutes. He used a small timer to remind himself. This was not exercise in the traditional sense. It was just breaking up the long periods of sitting. Second, he started walking to his mailbox and back every day. His mailbox was at the end of his driveway, about 50 steps each way. It was not far, but it was something. After a week, he added a short loop around his front yard. After 2 weeks, he was walking slowly around his block. Third, he tried some simple seated movements on days when his knees were bothering him. He would sit in a sturdy chair and slowly lift his legs, one at a time. He would rotate his ankles. He would gently march in place while seated. These movements kept his blood flowing even when walking was not comfortable. Fourth, he started paying attention to how he felt after moving. He noticed that after his short walks, he felt more alert. His mood was better. He slept a little more soundly. These benefits motivated him to keep going. Over the course of 2 months, Frank's blood pressure started to come down. He was not seeing dramatic drops, but his readings moved from the upper 150s to the mid-140s. His doctor was pleased with the trend. Frank learned that movement is not about intensity. It is about consistency. A little bit of movement, done regularly, is more powerful than occasional bursts of activity followed by long periods of sitting. If you have been sedentary, start small. Do not try to do too much at once. A short walk, a few minutes of standing, some gentle stretches, these things add up. If you have joint pain, balance concerns, or any heart condition, talk to your doctor before starting a new movement routine. For most seniors, gentle walking and simple movements are safe and beneficial. You can do this at home. You do not need a gym or special equipment. You just need to move a little more than you did yesterday. Light movement is a same-day lever. It can affect your readings today, and over time, it supports long-term blood pressure health. Now, I want to share one more thing that many seniors never consider. 8. What your blood pressure and blood sugar have in common. Gloria was 73 years old and came to see me because she was confused. She had been managing her blood pressure for several years. It was usually around 148/84, not ideal, but stable. She was also managing her blood sugar. Her fasting numbers were usually around 118, which her doctor said was in the pre-diabetic range. Gloria thought of these as two separate issues. She had one set of habits for blood pressure and another set for blood sugar. She did not realize that the two were connected. When I explained the relationship between blood pressure and blood sugar, Gloria was surprised. She had never thought of them together. Here is what many seniors do not know. Blood pressure and blood sugar often travel together, especially in older adults. When blood sugar is consistently elevated, it can damage the walls of your blood vessels over time. This makes them stiffer and less flexible. When blood vessels become stiff, blood pressure tends to rise. At the same time, high blood pressure can affect how your body processes sugar. The two conditions share some of the same underlying causes, including excess weight, inactivity, poor sleep, and chronic stress. This means that many of the habits that help blood pressure also help blood sugar, and many of the habits that help blood sugar also help blood pressure. Gloria had been thinking about these as two separate battles, but they were really part of the same picture. Here is what changed for her. First, she stopped separating her health efforts. Instead of thinking about what to eat for blood pressure and what to eat for blood sugar, she focused on simple whole foods that supported both. Vegetables, lean proteins, fiber-rich foods, and smaller portions of starchy carbohydrates. These choices helped her blood pressure and her blood sugar at the same time. Second, she started walking after meals. This is one of the most effective things you can do for blood sugar. A short walk after eating helps your muscles use glucose more efficiently, which keeps blood sugar from spiking. But walking also supports blood pressure by keeping your blood vessels flexible and your circulation strong. Third, she paid attention to her sleep. Poor sleep affects both blood sugar and blood pressure. When Gloria improved her sleep habits, she noticed improvements in both sets of numbers. Fourth, she managed her stress more intentionally. Stress raises blood sugar and blood pressure at the same time. By practicing calm breathing and reducing evening screen time, Gloria was helping both conditions. After a few months, Gloria saw changes in both areas. Her fasting blood sugar dropped from 118 to around 108. Her blood pressure came down from 148/84 to around 138/78. These were not dramatic changes, but they were meaningful, and they came from the same set of habits. If you are managing both blood pressure and blood sugar, understand that they are connected. You do not need two separate plans. You need one consistent approach that supports both. Focus on simple, whole foods. Move your body regularly, especially after meals. Prioritize sleep. Manage stress. These habits work for both conditions. If you use insulin or any medication that lowers blood sugar, check your readings regularly when making changes to your diet or activity. These changes can affect how your medication works. Talk to your doctor about any adjustments. The connection between blood pressure and blood sugar is one of the most important things for older adults to understand. When you see them as part of the same picture, your efforts become more focused and more effective. This supports steadier readings in both areas. Before I close, I want to ask you one more question. Comment below with your fasting blood sugar number and your age. I read every comment, and it helps me understand what topics to cover next. Let me take a moment to bring everything together. Your blood pressure is not just a number. It is a window into your health. Your top number tells you about your arteries. Your bottom number tells you about your heart's rest. The difference between morning and evening tells you about your body's rhythms. Sudden spikes tell you about stress and sleep. Consistently high readings tell you about sodium and fluid balance. Your readings over time tell you about how much you move. And when you look at blood pressure alongside blood sugar, you see how deeply connected these two areas are. Every one of these things is something you can pay attention to at home. Every one of them is something you can act on with simple, calm changes. You do not need to feel overwhelmed. You do not need to make drastic changes all at once. Start with one thing. Maybe it is fixing your measurement technique. Maybe it is checking in the morning instead of just the evening. Maybe it is adding a short walk after dinner. Maybe it is reading labels to see where your sodium is coming from. Small steps, done consistently, lead to meaningful change over time. I have seen this work for Harold, Doris, Eugene, Ruth, Walter, Margaret, Frank, and Gloria. All of them made simple adjustments. All of them started paying closer attention to what their bodies were telling them, and all of them saw improvements. You can do the same. If you found this helpful, I want to ask you to do one thing. If you know someone over 50 who could benefit from this information, share this video with them. It might help them understand their blood pressure in a new way. And if you have not already, subscribe to this channel. I focus only on blood pressure and blood sugar for adults over 60. Every video is calm, simple, and practical. No complicated science, no fear tactics, just useful guidance you can trust. Thank you for watching, take care of yourself, and I will see you in the next one.